Hello, my name is Vee Maliyasena. I'm a respiratory physician and I see patients at Family Doctors Plus. Today I've been asked to talk to you a little bit about asthma and some of the myths surrounding asthma. So just really basic things. So one of the commonest things that we get asked is, I'm an adult, do I need to use a spacer with my medications? The short answer to that is generally yes, unless you're an expert in using asthma medications, which most people aren't. They're very tricky to use. The reason we recommend a spacer is that when you use one of the inhalers, most of that medication is going to end up in the back of your throat instead of in your lungs, which is where it needs to be. A spacer essentially allows the drug to be dispersed into the canister or the barrel of your spacer, and then all you do is you breathe normally and then that goes down into your lungs. Whereas if you're relying on using it without a spacer, you take a puff, all of the drug, you then have to coordinate your breathing and make sure it's a big enough breath for it to end up in your lungs, which is why in most people they don't do that and it ends up in your throat instead. If you ever have any concerns about your asthma and how well it's controlled or not controlled, please come and see me. I'm here every second Wednesday. There's lots of common things with asthma control that we can also talk about. So there's 4 different things that I see that are related to poor asthma control in patients. So the commonest one is not using your medications or not knowing how to use them correctly. And again, we can help you with that. Our nursing staff, our practice nurses here are fantastic at doing asthma medication reviews and making sure that your inhaler technique is spot on. The second thing that's going to make your asthma poorly controlled is having indigestion or heartburn that's not treated or undertreated. Thirdly, having sinus disease and things dripping from the back of your nose down into your lungs, that's going to irritate your asthma. And again, it's very easy to treat and control. And lastly, having sleep apnea. Sleep apnea is very, very common. A lot of people don't know they have it or they don't get tested for it, but it's really important if you do have it, and most patients with lung diseases do, that we try and control or help you control that to the best of our ability. So asthma management plans are a really key component in helping you to manage your asthma and helping you to stay well. The reason we like to talk about them all the time is because it gives you an action plan of what to do when you're well, but most importantly, what to do when your asthma is not behaving as we would like it to do. It's really important with asthma that you know what your symptoms are. If you are able to do something called peak flow metering, which we do recommend, but not everybody does, peak flow measures will tell you what your lung capacity is when you're well, and if you do it regularly, when it starts to go down, it's usually the first sign of an asthma attack before you get symptoms. But having that action plan somewhere visible, like on a fridge, or if you take it to work on a notice board, so that you know if my asthma is well controlled, I take these medications. If I start to get a flare up or my chest is a bit tight or my peak flow's fallen, I need to take my regular medications and see my GP for some prednisolone, which is a steroid, or some antibiotics. If you have really severe asthma where you can't speak or you're having significant trouble breathing, you need to call 000 and come to hospital.